Okay, we're going to do retractors. Retractors come in varying sizes, and we're going to start with the smallest. These are called skin hooks, and the purpose is exactly what it says. It's a skin hook. And we're going to utilize these instruments on small incisions, like on the face or on our fingers and toes, to retract just the skin edges. They're not very deep. They're very sharp, so we're going to make sure that they are just used on skin, and we don't use them when we get down into deeper structures like tendons and nerves and arteries on fingers and toes. So that's called a skin hook. Next are sin retractors, and they come in sharp and dull. You can see as I turn them over that one is going to be sharp and one will be dull. Again, this is used on smaller incisions like feet and hands, maybe a small breast biopsy or something where the incision isn't very deep. We have the rakes part on one, and then we have the other end of the retractor is just an angle retractor. So those are called sin millers, sharp and dull. The next we have our rakes. These are rake retractors. Again, sharp and dull. We have a 3-prong rake. We have a 4-prong rake. These happen to be sharp. And we have a 6-prong rake that happens to be dull. And this is a dull. The largest of the rakes is called a Israel rake. They are dull rakes, large tines on these rakes, used in mastectomies or breast reductions, or a couple of surgeries that these can be used in. But this can hold back a considerably amount of tissue compared to the other rakes. Collins retractor, referred to as a 2-prong. Pretty simple description of the retractor. Again, utilized on shallower incisions. This next retractor is very common. It's called an Army-Navy. It's a double-sided retractor. I don't know which side is Army and I don't know which side is Navy, but it's called an Army-Navy retractor. Again, utilize different depths of your incision as to depending on what end you're going to use. This retractor is called a barred Parker or a band retractor. You can tell by the depth of the blades, again, that this is going to be used on shallower incisions like breast biopsies and small superficial abdominal incisions. As we get into the abdomen, we'll be needing larger retractors. This is a malleable or ribbon retractor. Comes in varying widths, not necessarily lengths, but you can have narrow to medium to large widths of a malleable. And it's just like the word says, it's malleable, so the surgeon can bend it to fit however they want to place this retractor. This is a Harrington or Sweetheart retractor. It's a Harrington. Sweetheart is just a nickname that was given to it, but it will help you remember the name of this instrument. This is like a heart shape, so I always said Harrington heart, and I could always remember this retractor. This retractor goes inside the abdomen. It is used to retract liver or any other structures to the side. This is a Deaver retractor, again used inside the abdomen, comes in varying widths, used to retract liver, bowel, anything intra-abdominal. This is the family of Richardson's, Richardson retractors. Different blades, different lengths of the blades give them the name. This is pretty much a standard Richardson retractor. They come in different widths. It is a handheld retractor. It is utilized to retract the abdominal wall. This would be a smaller version of a Richardson retractor. The shape of this Richardson retractor is referred to as an appy. This is utilized a lot on appendectomies because of the narrowness of the blade and then the length of the blade. So for the incision for an appy or an appendectomy, this would fit in perfect. And you would place one on one side and one on the other to pull retraction to open a small incision. So this is an appy Richardson. And this one is referred to as a baby appy. It's just another Richardson retractor. It's the size of the blade is why it's referred to as a baby appy in this region. This is an Eastman Richardson retractor. It's a double-sided retractor. One side is larger. In the Lincoln area, it is not utilized as much as I've seen it in other hospitals outside of Lincoln, but is a double-ended retractor called an Eastman Richardson. This is a Goulet, also a double-ended retractor, and you can just tell by the depth of the blade that this would be used for a superficial incision, but it is a double-ended retractor. These are all handheld retractors that we just looked at. We need to hold it by our hands in order to utilize this retractor. And so the next grouping of retractors I want to talk about are the self-retainers, because these free up your hands. These would be placed inside the incision and they would hold the incision open on its own. This is a mastoid retractor. It has dull tines, again used for superficial incisions, but they would place the retractor in and spread the tissues to whatever width that they wanted to, and it would stay, and it would free up the assistant's hands. This is called a spring retractor. There's two of them. Super sharp. Very, 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 very sharp. So you want to be careful when you're handling these. Hand it to the surgeon with the sharpness away. And this is used to go inside of a small incision, and it would open up the incision, freeing up their hands. This is self-retainer. This is a Gelpi retractor, self-retainer. You always hand these retractors closed. They'll place them into the incision and then open them to the width that they needed. This is a Gelpi, again, very, very sharp. Whenever you would hand that, you would hand it so that no one could get poked on those sharp ends. This is called a cerebellar and a Wheatlander. They look very similar from the outside. If we were just to look at them, we wouldn't be able to tell them apart until we looked at the tines. And you can look at the tines. The cerebellar just comes out, and the Wheatlander actually intertwines, and that's how I always remembered it. This looked kind of like a W a little bit. Not really, but a little bit. And this was more like a C, and that's how I distinguished between the two. But on the outside, they look very much the same. The next self-retainer is going to be the Balfour. We have a Balfour with attached blades, and then we'll discuss the other one in a moment. But the Balfour with attached blades has the wing nut in the middle, and then after the retractor is inside the abdomen, the surgeon will pack back the bowel, and this will be what we call the bladder blade, and that retracts back the bladder and some of the abdominal wall. So it's a self-retainer. This is an abdominal retractor for abdominal procedures. When you would hand a Balfour, you would hand it closed, just like the other self-retainers that we looked at. So this is a Balfour. And some facilities have Balfours that have detachable blades. And it would come in the set with long blades and with shorter blades. And so you would need to make that determination as to what size blades I need for my patient. So then you have to be careful as to how you put the blades on, making sure that it's functionable. My wing nut is on top. It would go in the abdomen, it would be spread open, and then the surgeon would place the bladder blade. We have, the next retractor is called the Heiss, and it is a small self-retaining retractor that is used for small procedures, small hands, wrist, carpal tunnels, small little incisions that we need to use a self-retainer on. It's called a Heiss retractor. And again, this is another very small retractor. It's called an Ulms. And again, it is used very superficial. The tines are very small, but it is used to hold back skin edges for vascular anastomosis of like your tibial artery would be a good one for that. And those are self-retainers.